So many moms are told the same thing. Pain is normal after birth. But what exactly does that even mean? When exactly is normal pain? And when does pain become a warning sign? And here's what's really scary. Now they're saying Tylenol is not even safe anymore. Today, we are cutting through all of the noise. What is fact? What is fear? And how to know when your pain is actually your body asking for help. Welcome to Fourth Trimester Voices, the podcast where we delve deep into the fourth trimester. I'm your host, Dr. Choa. Hello, everyone. Welcome back to Fourth Trimester Voices. I'm your doctor, Dr. Choa. I'm an emergency room physician, a postpartum care advocate, and I am here to dive into a topic that touches every single new mom, and that is pain. Whether it's from your incision, your breasts, your hips, your back, your head, pain is part of healing. How much is actually normal? And when should we worry? I'm also going to unpack something that is trending online, and that is about the concerns of Tylenol use in pregnancy and postpartum. I really want to share on this episode what the science actually says, how to think about pain and the management of pain without feeling dismissed or dismissing your own feelings, and when to reach out for help. So, why does pain deserve so much attention? Pain tells you that something is wrong. Naturally, we were given pain to signal in our body that there are some changes, whether we need to worry about these changes or we need to push through to get the results that we need to get to. For example, we have when you're working out at the gym, right? And you're working out, and that workout is super, super hard, and you are pushing through and it hurts, right? There's a certain level of pain that is needed at that point to get you to where you need to go. But then there's pain that is not okay, that tells you, hey, stop. You are doing too much. So we were given pain, one, to signal our body that, hey, we are going through some changes, but also to recognize that, hey, this may not necessarily be normal. Now, postpartum pain, I want to tell you it is real. You should not dismiss pain postpartum. Most times, it's telling you something. Too often, women are told that pain is just a normal part of recovery. And so a lot of moms end up just suffering in silence and sometimes ignoring warning signs of something more serious. I always share a story of one of my postpartum patients who I was just calling her to check up on how she was doing. And she was telling me that every time she was breastfeeding, that her abdominal pain were so severe that she was requiring taking a narcotic. Now, there is a level of cramping and some mild pain that you will get in breastfeeding, but she was telling me that she was taking narcotics. And when I asked her how long that was going on for, it had been going on for weeks. Long story short, she had a really, really difficult postpartum where she found out later on that she had retained products of conception. She had retained placenta in her womb and had to go back to surgery. So at that time, she was thinking, hey, this pain is normal because I've heard that people say you should have pain when you're breastfeeding. And so she's over here having severe pain to the point where she normalized it because that's what she was told. Now, we just have to know at what point pain is normal and when it is pathological, or meaning that something is terribly wrong. You just delivered a baby, or you're going to deliver a baby, depending on where you are. The body has gone through trauma. Your body has gone through hormonal shifts. Your uterus is shrinking and it's contracting down, and you may be breastfeeding and the baby is attempting to latch to your breast, right? A lot of this pain is a part of the healing process. But when the pain lingers or when the pain does not improve or it worsens, this could signal that something is wrong. Your pain should never immobilize you. Your pain should not keep you down to the point where you cannot move, that you're staying in bed because the pain is that severe. Your pain should not make you take strong pain medications. Your pain should not want you to feel defeated emotionally. You shouldn't be feeling dizzy, lightheaded. This is serious. So let's talk about sources of pain. Where can you have pain after giving birth? Okay, perineal. Perineal is that area where you deliver. So it's where the area you have your vagina, you have the area in between your vagina and your rectum, you have your labia, right? You have your vulva. All of this area is going to hurt. It's just stretched out for baby to come. You are going to be sore, particularly if you had tears. If you had significant tears, you are going to have pain, and this pain can last up to 3 weeks. Let's talk about a C-section. You had a C-section, someone cut into you, several layers of muscle, skin, fat. This area is going to be tender and sore, really up to 6 weeks. But I have had moms who have had pain longer, but it did not mean that that was normal for them. I had a mom who had pain lingering well into 12 weeks. However, we realized early on that her healing process was not normal. And so we had to do something about it, right? She ended up going to pelvic floor therapy, who did some incisional massages. She ended up getting some laser treatment, some cold laser treatment to her incision because her pain lasted longer. But we recognize this because after 6 weeks and her pain was just not improving, that is an issue. It should be improving as you are going week to week. Other pain that is normal, uterine cramping. You should be getting after pains, not lingering pain, after pain, and that is your uterus contracting. It's most notable when you're breastfeeding, right? But it is a mild pain. It should not bring you to your knees. It should not make you take oxycodone. This pain should be mild. Other places you can hurt, your breast, of course, right? They're going to get engorged as the milk is coming in. When baby may be suckling on your nipple and pinching the heck out of you. And then there's muscular skeletal pain. There's hip pain, there's back pain, there's wrists, there's the shoulders, there's the pregnancy. This is all from pregnancy posture. You were holding a baby for 9 months. You are now lifting a baby. So you are going to be achy. All of these are to be expected to a certain degree, and they should move in the right direction. It should not linger. It should not worsen. If the pain is increasing, it's localized. It's associated with other symptoms like fever, increasing redness, swelling. That is your cue that something is wrong. Pain should be telling you something. Okay? Let's talk about when pain is not normal. There are so many things that could go wrong in the postpartum period. And so I want you to be able to recognize when pain is not normal. Severe abdominal pain. What is severe abdominal pain? Well, we talked about it. It should be improving over time. It should not linger. It should not get worse. If you're having severe abdominal pain that is bringing you to your knees, or that is associated with dizziness, with fever, foul smelling discharge, this could mean there is an infection going on or that you have retained placenta. If you have intense incisional pain, or the wound looks like it's opening up, it's draining, it's red, you could have an infection. Chest pain. Chest pain is never normal. Chest pain is never normal in pregnancy unless somebody, not in pregnancy, well, pregnancy and postpartum, unless someone pinched you right here or you fell and hit your chest, that is not normal. If you're having chest pain in the postpartum period, you need to seek out attention immediately. If your chest pain is associated with shortness of breath, seek out attention immediately. A headache. I've had so many moms tell me that their headache is normal because they were like, well, I'm not sleeping and I'm stressed. So yeah, my headache is not normal. Okay. Take some Tylenol. Does the headache go away? Is the headache severe? Is it associated with blurry vision? Is it associated with swelling? Is it associated with high blood pressure? If you have a headache, I want you to reach for your blood pressure cuff. Don't think about, oh, I may be tired. Just go get a blood pressure cuff and check your blood pressure. If your blood pressure is normal, okay. Now let's think about this headache. Is it severe? Is it associated with blurry vision? Is it associated with, other symptoms? Neurological symptoms, numbness, tingling, all of these things matter. But if your headache is associated with high blood pressure, you need to be calling your OBGYN or midwife. Back pain. So many women are told back pain is normal, right? So many women are hurting out there. It is common, but it is not normal. You should not be having back pain. There are things that you can do about it. A lot of times it's posture, a lot of times it's weak muscles. And so when your body is sending signals to you that your back hurts, this is when you should be seeking out medical attention. They are chiropractors out there who focus on postpartum moms, who do gentle chiropractic care because that's important, particularly when you're postpartum and you have all those hormones shifting around. There are pelvic floor therapists. Sometimes your back pain is a result of a dysfunctional pelvic floor. You really need to seek out attention for this. If your back pain is associated with numbness, tingling, you cannot walk, you're having feverish chills, you need to seek out help. I do want to tell you there is a level of back pain. If you had an epidural, you could have what we say a spinal headache, and that's easily treatable. So don't just think, oh well, my back hurts. I have this headache because of an epidural, right? If you had an epidural, if you had any type of, gosh, why am I blanking? Spinal, if you had a spinal, you really want to make sure that if you have a headache or back pain that you're telling somebody or you're seeking out medical attention because a headache can be treated. You can get a dural patch so they can actually do a blood patch, put some blood in there and try to plug up the hole that is there. And so if you have a headache and it's particularly when you're postpartum, that headache is going to be better when you lay down, worse when you stand up. And so that is a postural headache, meaning it changes when you're going from sitting to standing. And that usually is common if you've had an epidural. And if it's 10 out of 10 and it's debilitating, you can actually get care for that. So do not suffer at home alone. Okay. Postpartum period can really hide silent emergencies. So many things can go wrong. Blood clots, heart issues, high blood pressure. But pain is usually the first cue. Pain is usually the first thing that your body tells you that something is going wrong. Let's talk about Tylenol because honestly, between Tylenol and ibuprofen in the postpartum period, these are really good, safe medications that you can take. In pregnancy, Tylenol is what you got. So the fact that there's a lot of attack on Tylenol is honestly concerning because it is what we have for our moms. Now, don't get me wrong, all medication has side effects. All medications taken above their recommended dose are going to have side effects. So if you are going to be taking long-term Tylenol and your doses are exceeding normal recommendations, you are going to run into side effects. There's been a lot of chatter on social media about Tylenol, but let me ask you something. How many of your physicians have told you to stop taking Tylenol? How is it that so many doctors can be on the same page? Because we are scientists. We have read the studies. Yes, there have been a few studies that have linked frequent or prolonged use of Tylenol, acetaminophen in pregnancy, and developmental and behavioral outcomes in children. Here is what is really important. Correlation does not equal causation. The studies show correlation and not causation. Just because something is correlated doesn't mean that this has caused that issue. A lot of the study relied on reported data. So, hey, yeah, I was taking some Tylenol during the study that they're doing. So, if every mom who's had an autistic kid took Tylenol during that pregnancy, it doesn't really mean that Tylenol caused the autism. It's correlated because it just so happens Tylenol is a very common medication. Of course, that most people are going to be taking Tylenol during birth, right? The doses were also unclear. How long people took Tylenol were unclear. There really has not been any proven direct mechanism that Tylenol leads to autism. Now, why am I talking about this in the pregnancy period? Because even though we're talking about this in the pregnancy period, moms are now scared to take Tylenol when they're breastfeeding. Yeah, so I think for a lot of moms, they're concerned. So this really applies in the postpartum period because if you're going to tell pregnant moms not to take Tylenol, of course, postpartum moms are going to be scared. And I really want to tell you that Tylenol is really first line. It's safe for you, it's safe for the baby. And so I would say that if you have pain, you should take Tylenol in moderation. We typically advise taking more than 4,000 milligrams of Tylenol in 24 hours. And if you want to be judicious, I would say 3,000 milligrams, right? And honestly, be careful to look at the labels because a lot of medication has Tylenol in it. So look at flu medication. Um, all of these things can increase the doses of Tylenol towards your total in one day. So be careful with that. Here's the hierarchy of what I tell moms in the postpartum period and when they're breastfeeding of what medications to take for pain. First line, Tylenol. I stand by that. Second line, ibuprofen. All of these are safe with breastfeeding, and ibuprofen is really good for inflammation. So, if you're having some mastitis or pain in your breast or, back pain, Motrin is really, really good. After Tylenol, after Motrin, then your doctor may give you some narcotics. What? We already know the risk associated with narcotics. You only want to take these if you absolutely need to take them and if you're going to be supervised. I don't want you taking narcotics, breastfeeding your baby, falling asleep, and something happens. Make sure you have someone in the home if you're going to take this. And then if you want to avoid all medications altogether, there's warm compresses, there's ice packs, there's stretching, there's pelvic floor therapy, there's hydration, there's gentle movement. Pain management is not a one size fits all. It is dangerous to tell moms to not take a medication that has been proven for decades that it actually works. What we need is for you to be comfortable enough to function, enough relief to be able to rest, to feed, and to care for yourself and the baby. It would not make sense, right, evolutionarily, for women to be in such pain that they cannot take care of their children. And so, if you are in so much pain that you cannot take care of your child, you should be thinking, what is going on with my body? Just because it is common doesn't mean it is normal. If you cannot walk because your back hurts, that is not normal. Something can be done about that. If you're in bed and you cannot move because your stomach hurts so bad, that is not normal. You need to tell your doctor about that. I want to give you a couple tips, and this is just how to manage your pain safely. I want you to track your pain. So let's say you're having back pain. I want you to figure out what triggers it. Is it movement that triggers it? Is it just there? How does it change throughout the day? Alternate between Tylenol and ibuprofen every 3 to 4 hours, every 4 to 6 hours, every 6 to 8 hours. I tell moms, try to go more than 4 hours with Tylenol and try to get to 6 hours with ibuprofen. Please do not ignore any pain in your wound. Any pain in your wound gets a phone call with your doctor. If you're having abnormal discharge, if you're having bleeding or leakage or smell, call your doctor. If you're having headaches, check your blood pressure. If you feel dizzy, check your blood pressure. Sleep, hydrate. If you are tired, everything is going to hurt. Trust me on that. Start pelvic floor therapy. Pelvic floor therapy will help just about most of the complaints that women complain of. Back pain, pelvic floor pain. I'm telling you, pelvic floor therapy is amazing. And a lot of women have even noted some improvement in their C-section healing and scar. Talk to your doctor, please, before using any supplements, herbs, or essential oils for pain. I'm always going to support you, but I want to know about it because I want to know if it's not safe for you to take. We got to keep in touch with our doctors. And if you have a doctor who's not available or the only time that you can see them in 6 weeks, I want you to find somebody else. Get in touch with that primary care doctor. If you're in Georgia, you can always call me. If you're in Tennessee, you can always call me. Keeping in touch with somebody is how we catch things early. So it's a wrap. That's the end of this episode, right? I want to end with Tylenol is okay. Tylenol, when used as directed, is still one of your safest pain options in pregnancy and postpartum. But there is a bigger message in this podcast, and that is do not minimize your pain. Whether it is physical, emotional, or both, your body is speaking to you. My name is Dr. Choa, and I am on a mission to make sure that mothers are cared for and not dismissed. If you found this episode helpful, I want you to share it with a mom. I want you to like it. I want you to comment. I want you to subscribe to my YouTube channel or my Spotify and follow me on Instagram at Dr. Choa for more conversations about the fourth trimester. Remember, healing takes time, and you deserve to be healed fully. Take care. Are you navigating pregnancy and postpartum alone? Are you feeling overwhelmed by the lack of support? You're not alone, and you don't have to do this alone. With EM Care, I offer personalized in-home and telemedicine support designed to guide moms through the challenges of the postpartum period. Whether you need total on-call services or periodic check-ins in the home, I help women recognize warning signs and I support you as your advocate, and I am here for you the entire step of the way. I want to create a postpartum plan that's all about you, your health, and your recovery. Follow me on Instagram at Dr. Choa for tips, resources, and to book me. DM me or email me if you have any other questions. I'm on all social media platforms under Dr. Choa, DrChowa. Let's build a village of support. Let's give you the hope you need to get through this period of time. Take care. My name is Dr. Choa, and it's been lovely talking with you all today. Take care.